die with multiple chronic illnesses. And probably the worst place to treat those people with chronic illnesses is the hospital. So you have to move care out of the hospital. A chronic illness, by definition, means you have it all the time. It's got to be self-managed. You know, the doctor can't be at your bedside every minute. We measure all these healthcare systems by 22 metrics. Yes. Everything from universal coverage to comprehensiveness of benefits to total cost to drug price regulation. And a couple of those metrics are about innovation in payment to doctors and hospitals, and then innovation in how care is delivered to patients. On both those metrics, the United States is leading. I think one of the things we need to do is put the fear of God into regular, everyday doctors and hospitals that are doing the marginal stuff. Instead of paying them fee for service, which encourages them to use more services, we pay them capitation or bundles so that they have a different incentive. Their incentive is actually to keep people healthy and use more cost-effective treatments. I think Ezra Klein had a great line about this. He says, you know, I really love my privacy, but I love my mother more. And I do think we have to figure out, and we have to create or have an organization that we trust. Who would we trust with this data? I think there might be a third party, if we knew that third party was not commercializing the data, was not merging this data for any reason other than to promote our health, and this data couldn't get out. I think that might be reasonable. Telemedicine, you know, the sort of joke in the system is, well, we did a decade of progress in telemedicine in 4 months. And every doctor now, almost all of whom were resistant to doing a lot of telemedicine because it wasn't paid, suddenly, wow, this is great, I can do this. What we're going to have is the challenge for the next couple of years is twofold. On the payment side is how do we pay so that doctors properly integrate telemedicine into their care armamentarium? And the second is how do we get them to actually use it in a way that is appropriate? By the end of the year, it'll probably be in the 250,000 range, right? So we're now, let's say, 4 months into it, and we've got 122,000 deaths. Right. We've got 6 more months of 2020, and we're doing better on mortality, but nonetheless, we are creeping up. So I think, you know, 200 is a safe number to say. 250 is, I think, probably a little bit more realistic. I do think that the full economic impact is yet to be felt, largely because we've had this unemployment pay. We've had various, you know, paycheck ways to preserve some small businesses, and it doesn't look like Congress is acting to do more. And so I think we are going to see the devastation that has been postponed a little bit is probably going to be coming over the summer. You know, I know a number of places that we have been to have permanently closed, whether restaurants or other sites, and that's, you know, it's really unfortunate.